I came today because I'm starting a project with the respiratory team at the Trust around readmission avoidance, and I knew that was on the programme, and I thought it would be helpful to have more background information. And it's certainly been very helpful to get a lot more clinical information. Although I have a clinical background, it's not something that is regularly updated. And not only have I got information for the scheme we're going to take forward, I also know there's a dashboard about soon to be released, which we've had a quick overview of today, which can give you a lot of up-to-date information on national parameters and how your own organisation is doing locally against the area and again nationally. And on top of that, during the workshop this afternoon, we've picked up another project too, so all's good and all's going to be very busy. We've got a lot to work on, but I really do think in the present climate we can improve services for patients that are more cost effective but better meet the individual patient needs.
I think this has been a really interesting and exciting day. I think what we now have is a situation in the United Kingdom where we know what our challenges are, we know what the problems are in respiratory disease, but what we've got is we're struggling to find what the solutions are. And the key thing that came out of today for me was to see groups of people, groups of networks, multidisciplinary networks from different parts of the NHS, from different clinical and managerial backgrounds, sitting down together and working out what their local problems are and what they think the local solutions to those would be. And from the point of view of someone who's already doing that in Scotland and who's trying through the Primary Care Respiratory Society to foster exactly that all over the country, that was a very exciting thing for me to see today.
And what will you take from the day in terms of the people that you've met here?
Well, I think I'll take the northwest of England as leading the way in respiratory as far as the current situation is concerned. And that although we have great big challenges, we've got demographic challenges, we've got challenges of disease, actually if we all work together and if we're all willing to work out what the solutions are locally for ourselves and in the whole region of the northwest, then progress will be made regardless of what political change is happening.
I came to today not really knowing much about what to expect, but I think I've learnt a little bit more about national policies, the QIPP agenda. I wasn't particularly that familiar with it before I started. I've also learned quite a bit about networking with other people, sharing ideas, which has probably been the most useful thing to me, is seeing what other people are doing in other regions and or within our own region, but different areas, and how they're implementing those.
And have you picked up some notions of good practice and things that you could apply within your own surgery, do you think?
Yeah, I think so. I think there's some good ideas and good practice that are out there that rather than us reinventing the wheel, we can certainly share that information. Hopefully the website and hopefully meeting again with some of these people will give us some ideas to base some strategies on within our own area. I think a couple of things as well was to be aware that patient involvement is absolutely vital in every process, and I think that we have to get that right from the start, that we've got patients involved in the whole process itself, really, to take things forward. I just really enjoyed sharing ideas, to be honest. It was the most useful thing I think I took out of it was what other people were doing, and hopefully share some of their ideas.
I've really enjoyed the feedback after each speaker today, so whichever area, it was nice to get feedback from other PCTs and what work they're doing in that area and have a little discussion about what they're doing. I think that's just really helpful to get everybody across the Northwest to hear that all in one room is such a quick way to network and find out who's doing what, and then be able to contact them afterwards, and that kind of thing I found helpful. Fantastic to get the evidence base for me to confirm we are going in the right direction, what we should be investing in, what maybe isn't, the evidence base isn't there for, and I feel much more comfortable about saying no, that we really don't want to invest in that direction. That's been helpful as well.
We cover about a population of 500,000, and we have got a lot of COPD burden in our population. Our COPD admission rate per year is about 800, and we have got very high readmission rate. We have done a lot of work on COPD over years. We were the first one in the Northwest to have oxygen assessment clinics, and we moved forward. Still, what I learned from the day today about the data that was produced by Jacqueline It was very interesting data that give us an idea about the care that we are giving to COPD patients. We were very pleased to see that in a lot of domains we are doing better than the peer group. However, our readmission rate are still very high, more than the peer group. And we have to look into that, why is that? So that was one thing. Other thing we learned today is that we have to work together with the primary care and other stakeholders. There is no other way out for us. And we are trying our best to provide a seamless service across the board. How we can deliver in this financial climate is a big question. So during the break, we had a meeting between ourselves. We did some learning exercise and decided we look into our readmission rate and admission rate and how we can make it better in the future.